Good afternoon, community of African Americans and peoples of color. You are listening to Physicians on Air, brought to you by the Medical Society of Eastern PA, representing the interests of African American physicians and the patients they serve in the greater Philadelphia region since 1961. We are the Philadelphia affiliate of the National Medical Association, representing the collective voice of Black physicians since 1895. You're listening to us here on WURD, which is, as you know, the heart of Black radio here in Philadelphia, the longest running and the largest full power, one of the 3 or 4 full power radio stations in the Black community here in Philadelphia. So WURD Radio. And I am your host, Dr. Bill King, a longtime pediatrician who is taken over from Dr. Sandra Magruder. I don't know if we all remember her back in the day when she was running the Medical Society of Eastern PA, but that was a great legacy of her work here with the Medical Society of Eastern PA, which is the affiliate of the National Medical Association. That is the Black doctors across the nation. But we are here today because we have the honor of having for us today one of our great leaders in organized medicine and one of our great colleagues across the state, Dr. Lynn Lucas-Fehm. She is the president, the 175th president of the Pennsylvania Medical Association. So the Pennsylvania Medical Association, PAMED, is the organization of all of the medical doctors across Pennsylvania. This is the affiliate of the American Medical Association. This is the representative of all 67 counties and their medical societies. You know, I've been a member of the Philadelphia County Medical Society for a long time. Dr. Lucas-Fehm was one of the past presidents of the Philadelphia Medical Society, so we're excited about that too. But we are really thrilled to have you, Lynn. It's so good to have you here on the show. Thank you for coming. We're sorry for the earlier technical difficulties, but we're all set again, and we wanted to just say thank you for being here.
Oh, well, I thank you for having me. It's an honor to do the show. I'm looking forward to it.
Yeah, and today, you know, we're here. My host, Dr. Ayanna Kersey McMullen, you know, she usually is on the show with us. Today, it's a pre-recorded show because you know, we have the opportunity to get you on today, and there's all kinds of stuff going on. But we're going to be broadcasting this on Sunday, and at 2 o'clock, as we always do on WURD. And so we look forward to seeing that. But today we wanted to really, I have to introduce you, and I have to kind of do that in its fullness. And that is because we're just so thrilled with the whole, you know, the whole process of what brought you here to represent us here in the state as the 175th president of the Pennsylvania Medical Society. So you were born in Indianapolis, I understand, right?
Yes, I'm a Hoosier.
Yep, that's right. So yeah, so there's some great Jerome Adams and all that's Indiana. There's some great
Indy 500, all that.
yeah,
yes.
right. But there's some great Black doctors coming out. But one of the things that really is special, we think, in the Black community is that your grandfather, father, and your father's sister, right, your aunt, were all physicians. So and then you attended undergrad at Princeton. You got your medical degree from University of Cincinnati, and then had your at Einstein Medical Center. You did your residency internship training in radiology. I understand, right?
Diagnostic radiology.
Okay. Yep. So we'll figure out what that is in a minute. and you earned your, but another real distinction is you then went to get your lawyer's, your Juris JD, or your lawyer
Mhm.
from Temple University School of Law.
Yes.
So the thing that I think that I'm really, we had talked about a little bit in the interview that was is so interesting is the journey of being there with your father, your father, your grandfather. So you you always wanted to be a doctor, it sounds like.
I never wanted to be anything else. As a kid, loved to go and see my dad in action down there. My mom and I would head down sometimes after school. I'd say, "Let's go see Dad at his office." I just loved the entire, just the profession of medicine from the time I was a small child. There was really nothing else I ever really wanted to do. My aunt practiced about 10 blocks from where my father practiced. She was actually in with my grandfather at his office until he passed away, and then she sort of inherited his office. But between the two of them, they really took care of the African American community in Indianapolis for so many years.
Yeah,
So
and now, and
proud
your grandfather, he was a general practitioner, you said.
as was my dad and was my aunt. They all were GPs, and they said that family practitioners were a new breed. They said not that there was anything wrong with them, but that being the old school GP, that was the way they were trained. They did everything for their patients. From when my dad first started, he would deliver babies. People would come in his office and need to have be stitched up. He did so with no questions asked. He was really the community general practitioner. He
Right,
even made
setting
house
bones,
calls.
house calls.
He even
Yeah,
made house calls. He had his
yeah,
little black bag that he had in there. Yep, he
yeah. Set
became
bones, and then taking care of kids and
everything.
moms and dads and grandmas and grandpas, everybody.
Yes.
Yeah, that's really the days of the giants. Now everybody, even me as a pediatrician, only children, or internal medicine, only, adults and older, so geriatrician, only older adults, only women's medicine. Yeah.
Right.
But he did everything.
He did everything. The last few years of his practice, he did give up OB because that became something that really was just for obstetricians to do. So
Yep.
as things became more specialized, he would drop those parts of his practice out of respect for his subspecialist colleagues. But when he first started out, he literally did everything.
Yeah, and you were kind of there with them, right? Your mom was a school teacher, you said?
Yep. Yep, she's a school teacher, but she then really became his practice manager, and we would go down together, and she really, made sure all the records and things that he needed to do his job were taken care of for him. So, um, it was a family business.
Yeah, yeah, and that really was kind of, I mean, you really were kind of right from the ground as a little child. You were exposed to that idea of medicine as a small business, as a family business.
Yes.
That really was the way that, for many generations, that medicine was practiced. You would be, the town's doctor, the county's doctor, the local hospital's doctor, and it was your practice, and you had, sometimes you're another relative who was taking care of it with you, right? Like your mom was doing.
Yes.
That's amazing. And now your aunt was also a general practitioner
Yes.
down. So that's just kind of down the street, or down
Yep,
across
not
town, just a
far,
little bit.
not far.
Not even across town, kind of just downtown,
Yeah,
right?
they're
Farther
both
downtown,
downtown. They're both
right?
downtown.
And
Absolutely.
this was in Indianapolis, in the Black community,
Indianapolis,
right?
Indiana. Yep.
Right. So, yep. Not Gary, which is, also
Not Gary.
yeah, we're
Nope.
hoping. So
And then,
that's incredible. And this was the Midwest, and this was through the whole civil rights era, through the right? Is that going
yes,
in? And it
yes,
goes back probably farther than that, right? With your
sure.
grandfather.
Sure. In fact, my grandfather's portrait was dedicated it was during the pandemic, I'm going to say about 2020, dedicated at the Indiana University School of Medicine. His portrait's on the wall as a recognition for him really being the first African American graduate of from the medical school. So his portrait is hanging right there in the lobby. So
Yeah,
um,
and so you know, I think it's important. You know, I'm here. You know, here we're on a Black radio station. We're talking. You know, as on a show, the Physicians on Air has been on the air for 20 years. You know, or almost. And the legacy from Sandra Magruder to Dr. Alexander to us, that we think is a legacy. But this is a legacy of medicine in the Black community that is not as rare as we think. That you know that the fact is that we aren't always coming from deprivation. Our community, in many cases, we're coming from legacy. That we have been around and we have been taking care of our community. The health, I mean, not just care spiritually, but health care,
yes,
practicing medicine in these medical and other professions. So, so what? Now, your grandfather's name was what?
Clarence, just like my dad too.
Okay,
Clarence
right.
Lucas Sr., Clarence Lucas Jr.
All right, so we can find him in the annals
Oh yeah.
in
You could
Indiana.
find him, and yeah, in fact, Indiana University did a very nice. I imagine you could probably access it, sort of a history of him and his life. It was done by one of the professors there named Professor Mullins. So he did a beautiful type of just like a presentation of his life when the portrait was being presented.
No, that's incredible. But we know that every doctor's journey, you know, is our own, you know.
It
So
is.
it is great. I mean, it must have been um kind of special, a unique feeling to know what business you're going into, to have that, you know, your own family representing that business for you, and to know, yes, this is what we do.
Yes. It's true.
Right. So
I didn't have to when people said, "What am I going to do?" That part it made it easy. The hard
right,
part was making sure I could do it and do it well. I had big,
right, and yeah,
big
and the
footsteps to
idea that
fill.
a black woman would be a doctor, it's like, well, my aunt is a doctor.
Yep, absolutely.
Yeah, or the a black man, you know, would be a doctor. Well, my dad was a doctor, my grandpa. Yeah.
That's right.
So that's but this journey was, you know, we all know that the journey into medical school, whatever chance that it gives you that resilience or that understanding, we still got to get through the long grind. And
Yes.
so you did your bachelor's at Princeton.
And yep,
Yep.
school,
In Jersey. Yep.
Jersey. Mhm.
Yep, and it's right halfway between the Jersey Shore and the city of brotherly love. And
Yes,
then we went back to the Midwest and did your medical degree. Your went to med school at University of Cincinnati.
I
So
did.
right back in the Midwest.
Yes.
But then you ended up coming back to Albert Einstein here on Broad Street in Philadelphia. So how'd you
Yes.
end up back? How'd you end up back
Well, I
on the
mean, I
East?
went through the match, obviously, and all that, but
Yeah,
certainly I was looking at a lot of different cities. Really was hoping I would indeed match in Philadelphia. Really liked Philadelphia, so but matched there, but had looked at what at that point MCP was still open. So,
yeah.
I ranked them all, MCP, Jefferson, all of them, and that is where I matched for Philadelphia. So,
Right. And then you had the distinction of also later getting your doctorate. So
my
that's pretty. Your JD. So
JD,
your
my JD
JD.
from
So
Temple.
your
Yeah,
law degree, right? At Temple Law. So right,
yep.
just farther, a little back
Guess I like
down Broad
North
Street.
Philly.
Right. Right. So just down Broad Street again.
Yes.
And so, but you're actually certified as and trained as a radiologist.
Yes, diagnostic radiology. I'm board certified in diagnostic radiology. Yes, but I
But
subspecialize beyond that. I only do breast imaging, and I do lots of breast biopsies as well.
but back at Einstein, you must have had to. Right. Okay. So, but Einstein, you must have had to do everything, right? You had to
Oh,
read
of course.
all the traumas, the trauma center that
Uh,
Einstein had, and do all of that.
Absolutely. There was, yeah, no, I did everything when I was there. It was once I was on the faculty, I was at Pennsylvania Hospital for what, 2 or 3 years. It was 99 to 2001. And then I was at Jefferson for 6 years. And there is
Okay.
where I subspecialized being in an academic institution where they are more subspecialized and only did breast imaging while I was at Pennsylvania Hospital and then to Jefferson. Then I went into community-based medicine at Abington Hospital, which I truly, truly loved. And I was there for 16 years.
Right. Okay.
And
Yeah, and Abington was one of those great is one of those was one of those great just county-wide community hospitals where all the different subspecialties come, and they admit their own patients, and they had lots of private practices.
they did, and then it sort of changed a bit as time went on because they were acquired by Jefferson, and then some changes then began to occur. And my practice, which is breast imaging, was actually sold to a private equity firm. So when mammography services sort of went that way, my group and I then moved as a private practice group, and now I'm in the Trinity Health System working for Mid-Atlantic Radiology Consultants, and we cover St. Mary Hospital in Bucks County, Nazareth Hospital in the Northeast, Mercy Fitzgerald in Delaware County, and St. Francis Hospital in Delaware.
Okay, right. And so that I was in my day I did a little bit of moonlighting for at Misericordia and also a little bit of Fitz Mercy. So I know that's the Catholic system. So that's I think those hospitals, the nuns are still there on the wards,
Yep.
and so so that's definitely you always have those blessings as you do your rounds. I think all
Every
four of
morning there's the
those.
morning prayer, but
Yes, absolutely.
it's
And the
good.
chapel is right there. Yeah.
But again, I'm
So
back with the feeling of being at a community hospital. Yes, it's a big community system, it's Trinity Mid-Atlantic, but still, it's more of a feel of a community hospital as opposed to the large health system or sterile
yeah,
feel. Now
that's right. And these all of those hospitals are still, and we'll talk about that in a minute about, say the challenges Fitz Mercy is facing right now with some
yes.
of these problems that we've had in Delaware
Uh-huh.
County where I live here at Yaden. But we have been, struggling with that. But you actually have always have kind of gravitated back towards these community-based hospitals
Yes.
and kind of the hospitals where it's still kind of one board, one hospital, groups of physicians in practice, and the patients kind of are directly working with one group of doctors, and
Yes.
it's
And
not it's
that's what
kind
I
of a
like. And I feel that physicians and patient interaction is much better that way. And physicians have a bit more, they certainly don't have total, but have a bit more autonomy as to what they do. And I think
yeah,
it's
yeah,
very
that's
important
right.
for patient care.
Yeah, I've been in private practice. I was at Temple initially in the faculty practice for 6 years, but then went to private practice, but in a Black private practice, and we're just independent. We're not affiliated with any of the hospital systems. We admit wherever our patients want to go,
Yes.
and that freedom and independence, it's worth a lot. It really is worth a lot as a practicing physician. I'm sure coming from where your family literally, practice as their own small business.
In a sense. Yes. Yes.
Yeah, I mean, it is hard. I think it's hard to say, oh, now I would like to be part of this gigantic machine.
Yeah.
It can be
Can't do
very,
it.
yeah, it's very difficult, I think. So now but you from that beginning in practice, you have also been involved in organized medicine almost from as soon as you were in training, right? So
Yes.
how did that work?
Yeah, so I was a member of the Young Physicians section, which has changed names, but still, it's like the younger physicians when you're starting out. And I have to say that the Philadelphia County Medical Society, wonderful, always has had just such a wonderful leadership and people who serve as people to encourage you to get more involved. And one thing they also said, not only do we want you to be involved here, why don't you get involved at the state? And so they would nominate me to be on different task force and committees at the state level. And at first going, I was like, oh, I don't know how this is going to work, but I have to say at the state level, the same sort of encouragement that they wanted to hear, from various people across the state and from different people what their views were and how we could work together to make organized medicine better. So it just it came naturally in a sense. And as I would be on one task force or one committee, someone else would nominate me to be on another one. And the more experience you get and better known you get, finally it came up to the point a few years ago where a group of my fellow physicians said, why don't you run to be president of Pennsylvania Medical Society, and nominated me, and here I am. So
Yeah, I mean it's amazing, and I've only been on in part of the County Medical Society and Organized Medicine. Now, when I was a med student, I was involved in SNMA, which is a student
yes,
section of
yes,
the National Medical Association, and was involved in some that national SNMA. But I kind of got scared from the national medical organized stuff, but have
yeah.
always really loved the interaction on the local level with the county medical society, because it is a way that you're actually connected to your actual peers in practice. You're not affiliating with each other as employees, the way you are at the hospital when you're kind of on rounds, or when you're working. You're really all, the boss is the hospital. But in the medical society, we're a guild of professionals. It's kind of like our union hall, or our doctor's lounge we have, in the county, where
Yes, the doctor's
we're
lounge.
actually meeting as colleagues. We're not meeting as competing business people, but we're meeting in a collegial way. So you were very involved in lots of that work at the state level and at the local level, right?
I did both. I did. I've been on legislative task force, been on the public health committee. I would just serve in whatever. I also did at the state level. The Pennsylvania Medical Society had a subsidiary called KeyPro. I did that for 10 years, which gave me a look of how like a business that runs that's in healthcare. So I got a lot of different experience over the years. So
Yeah, that's incredible. And you were the president of the Philadelphia County Medical
I
Society,
was in 2011.
yeah, that's right, about 10 or 15 years ago. Yep. So that was a great, we loved seeing that. We remember that back, that was about middle of my career right now.
Yeah,
And
great.
but now, as the president of the state medical society, you've been speaking on this idea of the influence of private equity, right?
Hey,
So what's now? So private equity, I mean, I have a 401k, and I know about, equity is stocks, and then they're in
yeah,
bonds, and it has to do with money and finances. And
yeah,
so, and then a pension fund is like public equity. That's like where all the teachers get together, they put their money together, and then we can get mutual funds and stuff in our retirement accounts, where that's equity, but those are publicly traded stocks like Apple or Target or Walmart.
right.
But private equity is not us individuals getting our money together to buy shares of Walmart. This is millionaires and billionaires and big piles of money pulling their money together to buy anything, right? They
They
kind of
can buy
buy.
anything they want.
Yeah,
Yes,
I know, like Arby's. I know Arby's is owned by a private equity. Like you can't
exactly.
buy shares of Arby's. It's owned by a
A
bunch of
private,
people.
that's
Yeah.
right. And
It's
so, I
not so
mean,
it's not a business. It's Arby's is not a business. It's actually owned by a bunch of rich individuals.
yes,
So every time we buy, an Arby's sandwich, that money is going not to like all of the stockholders, but it's going to that whatever hundreds
that
of
private
hundreds.
equity group.
Yeah.
Yeah, I mean, the way private equity works is a group of people that have money that want to make more money. I guess, it's the American way. We can't criticize that, but that is their goal. And they can invest in anything. They can buy anything. But
Right now, so private equity typically buys like oil wells or pipelines
they can buy
or
anything they
um,
want.
or timber. They'll buy a forest or something, and then they'll cut down. They'll get lumber and they'll get that together, or they'll buy a concrete companies, or a bunch of, or Arby's, a big franchise of, but but this idea of individual businessmen coming together and putting together not just, money to buy, like, so Dr. Huffman, my boss, owns her practice,
Yeah.
but usually somebody, so if when she's ready to retire, I have to get together money to buy the practice from her, a small businessman buying another business from another small business
Right.
woman. But that's kind of just a private business transaction. But
Right.
this is different,
This is
right?
a
These are
different
not,
animal.
this
Private
is a whole,
equity,
this is
it's totally different. They get together and they have one goal, money. It's all about
right,
profit
but
and
they're
where is
buying,
the money. So
but they're
what
coming together to buy doctors' practices. So they're
or buy
buying now.
anything that will make them money. And that what they are an expert at doing is knowing how to extract money. In the case of some practices or in the case of hospitals, what they'll do is they'll look and say, okay, where is the money in that? And it might be in high paying procedures. So when they buy the hospital or when they buy Crozier or when they, buy uh, Brandywine or Janitorville or whatever they buy. Well, those two were not private equity. They were owned by Tower. So I'll take those out of the
Yes,
equation. So we'll look at Crozier because that's the most
yeah,
egregious one in
retailer.
our
Yep,
area.
that's
So
right. Yeah.
they look at that and they say, well, you know what? They needed money because they're the area they're in. They at the point where they were bought, which is about 2016, for about I think $300 million. It may have been.
Hmm.
They needed an infusion of funding. And the promise from the private equity group is we're going to give you some money and we're going to make sure you work more efficiently and we're going to be able to to save your institution. Well, that's not what happens at all. What they do is they figure out where are those high paying procedures and they put emphasis on all those high paying procedures and services, and they make sure that each time those services are reimbursed, that profit is extracted and not put back in the case of Crozier, not put back to Crozier, but pulled off and given back to the investors because that's who invested the money and they expect their dividends. So what
Right, and so in their own now, so this was Prospect Medical Group, which was this,
Prospect
because
Medical
we're
Group,
Delaware County residents. We actually we talked about that. We brought some of the docs from around, and the Kathleen, the reporter for the Delco Times, was explaining that when Prospect took over Crozier, the toilet paper got rougher.
yeah,
The hand sanitizer didn't was plain and generic and didn't just have the lavender scent
right.
that made the patients happy. That the sterilizing service took longer. That the booties were rougher. The simple things, saving like 20 cents times 1,000 little booties that you put on your feet. The socks that you wear in the
All
hospital.
changed. The
Yeah, and
schedule's likely changed. How can we do more of the procedures that pay us more and fewer of the procedures that don't pay us as well, regardless of whether or not the patients need those lower paying procedures?
right. And now Crozier was a trauma center. On I-95. If you're anywhere between Wilmington and Center City, and there was a car accident, you were going to go to Crozier. That
Yep.
was the point. It was the trauma center. If there was a house fire in Delaware County, that was the burn center. You were gonna be able to take the ambulance to the burn center. You were going to be able to take the ambulance in 10 minutes if you had the heart attack in Delaware County, 500,000, 600,000 residents.
Yep.
But
But that's not what's important to the private equity firm. What's important to them, it's all about being pro-profit, not pro-patient, not about
right,
taking
and and
care of those
and
patients. So they
and now
want those high-paying procedures, and they're going to extract every penny that they can get, and they're going to put to the wayside anything that does not add to the dividends for their investors. And so little by little, as they extracted all those funds, there became less and less money for Crozier to balance its budget. And then the next trick that they pull is that the buildings that Crozier formerly were theirs, the prospect sets up something called a REIT, Real Estate Investment Trust. They take the buildings, those buildings that did belong to Crozier,
Yeah,
No
free and clear,
longer
no
belong
mortgage.
to Crozier. And then to make matters worse, they tell Crozier now you're going to have to, it's called a lease back agreement. You're going to have to pay us a lease price to use the buildings that used to belong to you.
Right. So they bought Crozier
Build
and
small.
Taylor and Springfield in Delaware County, and they sold, which were owned, had been owned over years, decades, by this medical group, this public and private, but mainly a nonprofit entity in the county, Delaware County, one of the biggest counties in the state. And they took that real estate, these hospital buildings that had been bought by the taxpayers and the
But
hospital
they didn't
residents, the
belong to
county
the
residents
taxpayers anymore.
owned free and clear, and they sold the buildings to this real estate investment trust to get money. So they, say it's like selling your house to second mortgage. You sell your house back to the bank. In this case, the private equity group, these prospect investors.
And actually, there
No,
was a
no,
group
no. The
above that.
prospects sold it. Prospects sold it to another group. That's right.
They had
And
something else up. Yes.
then that to get money, because the hospital needed money to just pay the bills and to pay for the blood bank and pay for the ambulance and all the other stuff. But now they're a renter in their own hospitals
That's correct. And
instead of.
the proceeds that they got from that didn't go back to the hospital. And in fact, as the hospital went more and more in debt, they took out another loan. And then they put that debt on the hospital's balance sheet. And what did they do
Right.
with that loan? They gave it to the investors of private equity as part of their dividend. So now the hospital's more in debt than it ever was before.
Yeah, and so this winter and this fall, I mean this spring, when we watched, we in Delaware County here, and I mean we're residents here. Me, Dr. Chris McMullen, we watched them. Said there's no way they can let Crozier just go away, because it's the trauma center in the region. It's the main trauma center. I mean the it's right there. Along the sports centers are all along there. Anybody gets in a crash at the sports centers are going to go to Crozier. So they can't possibly. Somebody is going to swoop in, but when everybody came to look, what they saw was this monstrous pile of debt
Debt.
that they would
All that's
owe.
left is debt. Every bit of potential profit had been extracted, is the term that often gets used, and given to as dividends to the investor.
So they couldn't. Any of the health systems, the Penn or Jefferson or Christiana or any of the big health systems that might have wanted to come in and just say, okay, we'll take over the hospital. We'll just pay the doctors and nurses, and we'll just pay for gas for the ambulances, and pay for all the equipment, and we'll just we'll run we'll just kind of break even point. No,
There's too much
they
debt.
would have to come in and take over set 80 million, $100 million of debt,
It was millions.
and four mortgages for
Yes.
hospitals that were already paid for, that
Already
need their
paid
own
for it, and
equipment. You have to
that have
buy.
no real potential to get out of the debt for a lot of reasons. I mean, we could do 50,000 shows
Yeah.
here about the payer mix that is there. It's going to be hard for the hospital in that area to turn, realistically, to turn a big profit to make up for
Yeah, to
the
pay,
amount
right,
of debt
because
it's taken.
because these are community hospitals, and in general, that we all, I think all of us practicing as doctors, we're not doing. My uncle, who was a business finance guy in Newark, New Jersey, when he heard I was going into medicine, he said, hey Bill, you can't make money in medicine. You're going to be taking care of people. People don't have money. You got to work with money to make money. I said, well, I'm not doing it for money. He said, yeah, well, good, because you're not going to make any money. But medicine, most of us as doctors, we don't think of it as a way to make profit. We think of it as a way to take care of patients and
Yep.
use our talent, and
That's
we
what
hope to make a good
our idea
living.
of the business is, the business of taking care of patients, not the
Right.
business of
Of
extracting every
making, we
penny
don't think that
you
we're going to be able
can.
to get
Yes.
money from those patients. Right. We're hoping to make a living
That's right. Make a
taking care of
living.
our
And the
patients.
business is good health care. It's not extracting every penny you can. But the big problem with this is there's no transparency. We
Yeah.
talked about Prospect Medical Holdings. A Behind them was the true private equity group. They were sort of like the management company, and I believe it was called Leonard Green Partners. They were the actual
Oh,
uh, equity firm that gathered those investors that then had Prospect buy Crozier,
right.
manage it. So there's
And then
always
now
more behind it. None of that was transparent. All that comes out.
nobody could tell, right?
Nobody
Who
can
actually
tell.
owned it and how, yeah, and how you ended how a bunch of guys who were just trying to make a bunch of money thought that they could make a bunch of money by buying a hospital that takes care of an impoverished fairly impoverished working class county and city, Chester and Taylor and Riddle and these small places.
Right.
Now we're sitting here in a county that has had 6 hospitals and there's only 2 left. Riddle and Fitzmercy, the one you're talking about, part of Trinity, trying to take over all of this
Yep. And they're
care,
doing their
all of
best
these,
to try and
but they
stop.
are overwhelmed.
They're
They are
overwhelmed. There's
overwhelmed.
just too many patients and too many underinsured patients who coming in that, obviously look to coming to the emergency room sometimes as their primary caregiver. And it's so
And
difficult.
and and now you saw that also though not it's not just hospitals that these private equity entities can buy, but they buy whole groups of physicians practices, right? The radiology practices.
Radiology practices, I understand gastroenterology is highly infused with the private equity, and they know just how to set things up to make sure that they get every dollar they can extract from the higher paying GI procedures, radiology procedures, anesthesia, all of those things. They know exactly what they want to do and how to do it to get the maximum amount of funds out. And at the same time, when the ability to extract more money becomes more difficult, they cut services. And that, I believe, happened quite a bit at Crozier. They saw that
Oh,
some
massive,
all of a
massive.
sudden, we're not going to provide that service. It isn't because the patients don't desperately need the service, it's because it doesn't pay enough
Right.
to give us the dividends.
Yeah,
So
they closed Delaware County, which is just the
it
main
doesn't pay enough.
hospital in the county. They closed they closed the maternity unit, they closed
Exactly.
the trauma unit, they closed the cancer center, and then and then all of a sudden the emergency rooms closed, and now what is there? Yeah.
Now, the other thing that private equity wants to do is to flip things as quick as possible if they can, and they do that. The one private equity firm will have, if the healthcare entity survives, they'll want to flip it in about 5 to 7 years, take their profit, sell it to someone else. I mean, it really is all about making money. It's 100% pro profit and 0% pro patient.
Yeah, and this seems insane. The idea, I mean, I understand the idea of you're buying a silver mine,
Yep.
and you think you're gonna, extract silver out of it, but the idea that you think you can extract money out of cancer patients or
But but they do.
colonoscopies, no, yes,
Yeah.
by charging high and trying to underdo. So that's really this is beyond kind of the idea of that we fought fighting insurance companies, who are the bill payer. These are actually the owners of our of practice of our way of practice. So instead of being individual professionals, we are employees of a business that's there for money, and
Totally
that's
for
kind of
money.
antithetical. That's antithetical to what we do as
It
doctors.
is, which is why, there's a bill now. In fact, they've tried it a few times, but I think this year it has a chance of going through in the Pennsylvania legislature, bill, but it's 1460. And it basically what it will do is require oversight before one of these private equity people can come in and buy up a hospital or buy up a bunch of practices. It will make their proposal on how they're going to do it have to go through the attorney general's office before it can be approved. Let's hope it gets some traction and goes through. Right now, it has a lot of support and it has the governor's support. He is quite upset about what has gone on with private equity in terms of Crozier and all types of practices. And just the other day, Genesis Healthcare filed for bankruptcy, and who owns them? Private equity.
Now, Genesis is, where are they? They're out of
They're
Western,
based in Pennsylvania, and they have
yeah, Western Pennsylvania, kind of
and
Western, middle and Western, yeah.
yeah, there's some Genesis nursing homes in the greater Philadelphia area as well. They just declared bankruptcy. And if you look into them, do they own themselves? No, they're private equity. We got the
Right.
same thing going on with them. And
So
for
this
Rat
is kind of
Kahneman, it was the same thing. That was private equity, a private equity
Hahnemann. So
called
Hahnemann was
Paladin.
also private.
Yeah, Paladin was
Hahnemann was
private
also,
equity.
yeah. So, those of us that have been in practice a long time, this, in the same way, the closure of Crozier to Delaware County is a trauma. But the closure of Hahnemann was something I think
Tragic.
that was a tragedy at the level that we in practice could not imagine in Philadelphia. That along the Vine Expressway, that you wouldn't have a trauma center, an emergency room that you could
Exactly.
go in
But
and,
again, what did they do there? That private equity company ended up owning the real estate. So was
right.
it about the real estate? Probably was about the real estate the whole time. And my
Yeah, and
understanding is it's kind of sat there for a few years, but now it's been sold again. And indeed, I understand it's going to be developed into like condos or something. So
so the Hahnemann Hospital, that institution in the center of the city,
yes,
Hahnemann, this is the hospital that was the homeopathic hospital from the 1800s.
yeah,
It's, I mean, it isn't even, it wasn't, it's so old that it was practicing like a field of medicine that we don't even practice out of a hospital anymore.
yep.
Hahnemann was,
It's
it
probably
goes
going to
back to
be
the, and
condos, it looks
it's
like.
going to be, the whole building is going to, there's going to be no medicine,
Well,
right?
there's no medicine in it currently, is
Yeah,
my
no, no, right,
nothing,
right.
nothing. It's just sitting there. But yeah,
But from their point of view, it's prime center city real estate.
it's real estate.
Yeah, why not, knock out take where the emergency room, you can just do retail,
Yes,
and maybe have cafes and on the ground floor, and lofts and condos on, yeah, and read, and just, or take the whole building down. That is, it's unbelievable to think about this. But I think this is something that the community has to understand, right? That it's not just the federal, the federal government, the bill payers, and all these cuts that are going to come to Medicaid,
yes,
that we are all quaking in our boots about.
yes,
But that the system of care is is um, is being pulled farther and farther away from us, the doctors, no, us, the patients, us, the communities,
yes,
us, the county. We had Monica Taylor, the county commissioner,
yes,
just helpless to stop Crozier from being. They just, all they had to do was simply file as a business for bankruptcy, where a community would never have allowed that hospital to go away. But it
exactly.
wasn't owned by the community. It wasn't owned by the politicians. It wasn't owned by the municipality, the county, the nuns.
Right. Yes.
It was owned by these
It
things.
was
It's a
right.
business can come in
Nameless,
and
faceless
just buy it for the
business.
real estate, like it's a shoe, store, or a,
So it just simply doesn't, we business is part of the fabric of the society. We can have a whole debate about that. But something about this completely 100% for profit model and healthcare just don't seem to quite mix. There's got to be some guardrails on this. And
yeah. And I think doctors, we have to, this next generation, they're talking about unionizing, which I think, we're, in the Philadelphia County, we're very supportive of that, if that's what they want to do. But as old private docs, we're kind of, we look at that really, sadly. It's
yes,
like, well,
yes,
that's
you need to do
that's
that.
right. So because if you were your own business, you wouldn't have to unionize it. The problem is that we're all now employees. Many doctors, many of the young doctors would never think of not working for one of the big health systems, one of the big academic medical
Yes,
centers, or one of the big, Tower Health, or and obviously these institutions are great, pillars of our city and our state. But when they mix business, and they start thinking they're a business instead of a university, a
yeah,
business instead of a hospital,
right.
then as doctors, we kind of have to say, wait a minute, what's the point of, we're not in a business. This is a profession. This is a, we have an oath to
Yes,
do no harm.
right. So
Yeah.
it's all
So
about, for me, when I go in, like I testified, there was a hearing held by the politician in Delaware County. Actually, multiple counties came to listen to it. It was all about Crozier, trying to stop
yeah,
it from closing, but it was back in January.
yeah,
Um, and one of the things I stress the most is because as soon as these bills get into the legislature and are open for debate, you know that there's going to be naysayers who say that we're trying to over regulate and stop business and the whole thing. It's not about that. It's about there's a recognition that unfortunately money is involved in healthcare, but you cannot let it overtake any of our moral obligation and what we have sworn to do, which is to care for patients. And when that need for greed overtakes that and overwhelms the mission of caring for patients, that's when we do have to step in and do something. I'm not saying you can't have any business. Yes, you can't, but you cannot let it destroy patient care.
yeah. That's right. It has to be. It has to be a regulated
Balance.
business, like a utility or something.
It's got to be a
And so,
balance there.
so what do you think? I mean, do you think that this is going to be something that is going to be doctors in the community? It's going to be doctors and the politicians? I mean,
To get
how
this
how
bill
is
through, you
well?
mean?
How, I mean, how are we going to, we as a civil society? How are we going to protect each
Uh,
other?
yeah.
What do you think?
Well, I think one of the most important things is one for us to realize who are our partners in this and
Hmm.
who do we support in this. And we need physicians and patients to be partners in protecting healthcare and physicians and their fellow physicians to do the same.
Right,
And it's
right. And the
it's
nurses
the
and
nurse, all the
the
healthcare,
allied health
there's
professionals.
we have to be come together more, and we have become so fragmented.
Yeah,
It makes it hard. I hope, and one thing that I noticed at the hearing, the panel that I was on, I was sitting next to the medical staff at Crozier, uh, and the head of the emergency room, the head of nursing, and we were speaking as one voice as to why this was bad for the community. So we were speaking for the patients. We need more of that activity where we're not just divided, because as soon as we're divided, we're not going to get anything done. And it's
yeah.
going to continue to be a way for business to just totally continue to devour whatever it wants.
That's right. And I think that we have to, we as doctors, I think we do have to, this is physicians on air. And, a lot of times we're trying to give health information to the community. But I think sometimes we have to be able to be humble enough to say, hey, community, we need you to stand up, not for us doctors,
Right.
for your health systems,
That's it.
your
We need their
hospitals.
help
Yeah,
because
because
we are
right,
actually small in number.
yeah, we're not the voters. We're not the taxpayers.
Yep.
Right. We actually don't have the votes to actually persuade. I mean, we make our phone calls, but because of this fragmentation, the political forces and the economic forces look and say, you sound like employees to us. You don't sound like you're in our boss. I think we're your boss.
Yeah.
So as doctors, we are citizens, and so I think we have to recognize that, and we're so happy that you're there in Harrisburg to help guide our the lobbyists for the county and the state medical societies who are up there in Harrisburg trying to convince our politicians to intervene on our behalf to help protect us with the law.
Yes.
Um, and the other thing that we really want is the young doctors to understand, that us as a profession. So what do you think? What do you have to what do you have to say to them in terms of the young physicians who are might be listening, but also the families whose kids might want to be physicians. What do we want to tell them?
Yeah. I think one of the things I've tried to do this year, and I've done a lot of different recordings, which I'm going to have to ask you to do one, is turnabout is fair play, as they say,
That's right. Yep. That's right.
where I interview physicians who have decided not to do the big healthcare system and have started, younger physicians who started their own practices. Um,
Oh, okay.
some are doing the direct patient care model. Some are just, opening up their own offices. Yes, they're way in the minority, but the general feedback I've gotten from them is that they're very happy they did it. It was hard to do. So I want to get the message out there that there are options and that there's nothing wrong if you say, look, I do just want to work for a large health system. But you want to make sure that in doing so, you are okay in some way giving up your ability to be heard. I mean, when you do that, you often give up your right to speak. Now, if they're comfortable with that, then okay, that's their decision.
Right.
They went to medical school, but I want everyone to know, our fellow physicians know, there really are options out there. Uh,
Yeah.
I'm in private practice. You're in private practice. I have a series of videos on my physician initiative webpage of independent physicians who,
Yeah. Our in the MSEP, the medical society, our president, she has her own practice. And we also emphasize that independence of practice, even if you are working within a health system, trying to maintain that independence of your own style of practice, being able to say, I'm practicing individual, it's my license, it's
yeah,
my oath. I have to practice this medicine in the way I was, my training and my value system. It isn't about what the business model. I mean, I'm sure your dad and grandfather had to do many visit where the payment was in I'll pay you later, or I'll bring
oh,
you some jam, or
he used to come in with the worst ties. Sometimes my mom would say, "Why are you wearing that tie?" My patient gave it to me.
right,
She's like,
right,
"Okay."
right, right,
So yes, a lot of that.
right. But I think that that's right. We really appreciate your being able to stand up for for doctors who want to actually stand with patients. To
That's it. We
really
need
be
to.
practicing hand in hand with our patients, not trying to figure out like who do we have another master.
Yeah, yeah. We need to learn to, I like to say, we talk about advocacy. I like to say we want to advocate with our fellow physicians and advocate with our patients.
Yeah,
Yeah, we
because
want we want
this
them by
healthcare
our side.
system is because it looks bad. It could look worse. I mean, the if you pull all the money out of it and then you try to make what's left all for profit, that's going to be a disaster. I mean,
If
there's
we
you know
do
there's
let the business take over everything, I don't know what to
heaven
say.
help us all. Heaven help us all. Yeah, we will need those nuns at Trinity to pray for us then for sure, because it's an impossible thing to we it's hard enough to solve, the to figure out the radiological dilemmas without having to figure out like who's paying what, how what you're trying to cut money. No.
Yeah.
So now, now you as a radiologist, we only have a few minutes left, but we do want to take advantage of your expertise and all these years as a diagnostic radiologist and a breast imaging
Yes.
physician. So, our patients our listeners who are women and who have and our men who are listening who have wives and mothers and daughters. What should we really be telling our loved ones in terms of what they need to be doing about breast health, to make sure that they're not late, or they don't have to face the tragedy of breast cancer that's difficult to deal with.
So screening mammography, I mean, the data is there, it works. It Now the question is when to start, and there has been some confusion. I feel bad for the patients that get confused by the variability in the recommendations. So I can just tell you what my profession, I'm a board certified radiologist in the American College of Radiology. What do we say? We say a woman should start getting a mammogram at age 40 and have one every year. Now, there are some conflicting ones, and so I'm going to say talk to your own doctor. As you see, I have a lot of respect for the personal doctor patient relationship. But I will tell you, the American College of Radiology feels that a woman starting at 40 should have annual mammography and might even start earlier if she has the BRCA gene, the BRCA gene, or
Yes.
has another genetic predisposition for breast cancer. or at elevated risk. And it gets a little more complicated there. We have
Yeah, as you go. But this is, so these are these, if you have like if your mother, your sister, your aunt, a first degree, grandmother, a first degree relative
start sooner.
has had a history of breast cancer, then that you might want to ask your doctor about getting this genetic test.
That's right. And
And
if
then,
your risk factors end up to be more than 20%, and there's these different models that get utilized, then we recommend annual MRIs if you have an elevated risk, if you're more than 20%.
yeah, so again, it's about advocacy, huh?
And it is. It
Yeah,
is.
it's
It's
to say,
getting
hey,
into the
I'm 40,
doctor.
I think I want a mammogram.
Yes, and there's nothing wrong with that, even though you have some conflicting data. And the reason for the reason not doing it is that they said there could be false positives and you end up having to have more testing. I have to tell you, I have not had a patient say to me yet, I feel bad that I had to come back to get these, this extra testing or
Recheck, yeah,
reviews. I'm happy you were careful. But
yeah,
the criticism is with younger women, there's a higher false positive rate. However, in younger women between 40 and 49, which is where there's a bit of controversy about getting an annual or starting at 40, when they do have cancer, it often is more aggressive. So
yeah,
it's so that's the recommendation of the American College of Radiology, but talk to your doctor. I don't want to get in between
yes.
that.
No,
I would say at age 40, that's when to start.
so family, we want you to talk to your doctor. We want you to ask your relatives and ask for this genetic testing. And then if you're getting close to 40, talk to your doctor about getting that mammogram. Dr. Lucas-Fehm, I'm so thrilled to have been able to talk to you.
Wonderful.
We are just thrilled you being the 175th president, and we'd like to ask you to come to talk to us in the future, and I'm happy to come and talk to you,
Good.
and us talk to you about that. But how can we reach you, the citizens, in terms of reaching out to the county medical society?
Yeah. So I guess it would make more sense, I guess, at the county level. I mean,
I'm sorry, at the state medical
at the
society.
state
Yeah,
level, yeah, I was going to
yeah.
say, I mean, we have our new executive director. I don't want to put a lot on him, but
No.
I mean, think the best way for physicians to contact me, if they go on the Pennsylvania Medical Society website, and
Yep.
you don't have to be a member, although everyone should be a member, but
Yep.
it says connect with me. Right
Okay.
on when you go on, it is a presidential initiative. Sometimes my picture pops up, which is a little unnerving, but there's a thing about the presidential initiative, and then it has like a picture and a write-up, and at the bottom it says connect with me.
There we go.
And
That's
you
that's all we have to
click it
do.
and it will get to me.
That's wonderful. So, Dr. Lynn Lucas-Fehm, we are so thrilled to have had you on, and that's what we're going to do. We're going to not just doctors, but the community, and if anybody wants to reach the president of the Pennsylvania Medical Society, they can go on pamedsociety.org, and you'll see that she is the 175th president, and we get to go to the Connect with Me button, and that'll reach the staff and everybody, and get to you. Yeah,
Yes. I have a
and
staff that they're
yeah,
wonderful.
everything. That's right.
They are. They're
So
very helpful. They're very
so
good.
we're so happy to have you on. Thank you for coming, and again, this is Physicians on Air, and brought to you on WURD, and you can reach out to us on blackdoctorsphiladelphia.com and WURD Radio to reach out to us. But thank you all, and we will see you next month.